I want to talk about Dr. Hussam Abu Safiya, the Palestinian paediatrician and the director of Kamal Adwan Hospital, who I had the privilege of meeting on the 1st of May 2024. 2 years later, he is now at imminent risk of being killed within Israel's notorious Nitzan prison. He has been held captive now for more than 550 days without charge and without conviction. I met Dr. Abu Safiya on that day in May 2024. We were part of a small UN convoy that had been coordinated and granted access to travel from the south of Gaza to the north. We had a list of patients that we were meant to retrieve from Kamal Adwan Hospital, who we were then going to take to the south, where they would wait for evacuation out of Gaza. When we reached Kamal Adwan Hospital, the entire hospital was extremely crowded. The external courtyard, the stairwells up to the wards, each of the wards was full of patients. And that's where we met Dr. Hussam Abu Safiya. We were greeted by him and his colleagues. And I was accompanied then by representatives of the WHO and Doctors Without Borders, MSF. We were all invited to sit around a table in his office. And for the next, I think it was 10, 15 minutes, he and colleagues explained to us the many challenges that they were facing as the northernmost hospital in Gaza. A lack of fuel, a lack of medical equipment, electricity blackouts, of course, the continued Israeli targeting and violence in the area, the high number of casualties, severely unwell patients with complex medical and surgical needs that could no longer be cared for under those conditions. And I remember very vividly that the sound of the Israeli drones was constant. Dr. Abu Safiya, he then showed us around the hospital. As I say, the entire facility was overwhelmed. We were taken into the pediatric ward. Dr. Abu Safiya is a pediatrician, so we were shown children under his care, tens of very unwell children, some extremely young infants, others older teenagers. Many of them were visibly malnourished, and others, if not all, were in need of medication that Israel had blocked from reaching the hospitals. On that particular day in our ambulance, we transferred 4 children from Kamal Adwan to the south. 3 of them had suffered horrific injuries, and a 4th patient that was in urgent need of an organ transplant. All of those patients, those we transferred and those that stayed in the hospital, had been meticulously cared for by Dr. Abu Safiya and his colleagues with what little they had left available to them. The next time I would see Dr. Abu Safiya was after I had left Gaza. I saw video footage 8 months later, images that circulated of the doctor walking towards 2 armored Israeli vehicles that were positioned on a street adjacent to Kamal Adwan Hospital. Many of you will have seen the harrowing footage of Dr. Abu Safiya walking alone, standing upright, facing straight ahead, wearing his clinician's white coat and walking directly towards those Israeli soldiers, the very same soldiers that had repeatedly attacked, stormed, and surrounded his hospital over the course of weeks and months. We know that dozens of patients and staff had been killed inside the hospital itself, and many more in the immediate vicinity of Kamal Adwan. And thereafter, Dr. Abu Safiya was forcibly disappeared. Very little was known about where he was or whether he was even still alive at that point, until an Al Mazan lawyer was able to visit him in February of 2025. And at that point, it became clear that he had been taken into captivity and was being held in detention within Israel's carceral system. By that time, February of 2025, he'd already been subjected to torture. He'd been stripped, he'd been repeatedly beaten, and he'd been held in prolonged solitary confinement. 2 weeks after that meeting with his lawyer, Israeli media posted video footage of Dr. Abu Safiya. He was shackled both at his hands and at his feet, and he was surrounded by Israeli prison guards. Their faces were completely covered. They were wearing riot gear. And, we know that accountability is unlikely to haunt Israeli prison guards and soldiers. But even then, it was very clear that they were not going to take any chances of being identified. Dr. Abu Safiya has been held in captivity ever since the 27th of December, 2024. No evidence has ever been made public to justify Dr. Abu Safiya's detention. And of course, there is no evidence that would ever justify the violence that has been inflicted upon him. His crime is simply that he chose to stay with his patients, that unlike the staff of UN agencies and many other international NGOs, international medical workers who worked at Kamal Adwan Hospital, he refused to leave. And in doing so, he afforded no legitimacy to Israel's repeated attempts at ethnic cleansing. We know very well that those who heal with their hands, those who resist erasure by saving lives, will always be considered a threat by those who seek to commit genocide. And as such, this is how the genocidal Israeli regime has continued to treat Dr. Abu Safiya. During the last visit from his lawyer on the 2nd of July, he'd been beaten so badly that his lawyer could barely recognize him. He had difficulty breathing. He was profoundly weak. He appeared on the verge of losing consciousness on several occasions, and he was clearly severely distressed and anxious. He said to his lawyer, "This is the last time that you'll see me. They brought me here to kill me." It's abundantly clear that Dr. Abu Safiya's life is in imminent danger. We also have to be clear that there's no doubt at all that this risk is real. We know that at least 6 Palestinian healthcare workers have been killed in Israeli detention since October 2023. Many other Palestinians have been killed within Israel's carceral system within that same period. In the face of all of this, the torture, the brazen mistreatment, the repeated human rights abuses, the repeated acts of brazen impunity committed by Israel, those with the power to act elsewhere in the world have opted instead to sit back and watch as Israel has wrought death and destruction, not only throughout Palestine, but throughout many other countries in the region. We know that the detention, torture, and killing of Palestinians within Israel's carceral system is far from an irregularity, nor is it the work of a few rogue prison guards or unhinged parliamentarians. What it represents is one of the most wicked consequences of Israel's intrinsic need to dehumanize and oppress the Palestinian people. It's been said many times, and it must be said many times again, that Dr. Hussam Abu Safiya must be immediately released. So too should all Palestinians being held in detention, including the other 82 healthcare workers who were still being held within the Israeli prison system as of April of this year, a total of 23 of whom had also worked at Kamal Adwan Hospital. What's even more clear is that our obligations cannot and should not end there. There's no such thing as a human rights compliant settler colonialism or dignified apartheid, humane occupation. We know that the viability of Israel as a settler colony hinges on the continued torture, detention, and dehumanization of the Palestinian people. And as such, there really can be no prospect of an end to these acts of brazen depravity for as long as settler colonialism is permitted to thrive.